One of the challenges facing public health is the ability to attract and retain highly qualified personnel. On March 27, 2008, Sacramento County Public Health Officer Dr. Glenna Trochet and other officials participated in a news conference with Congresswoman Doris Matsui. Matsui has introduced legislation that would provide financial and other incentives to students and graduates to enter the important field of public health.
Microbiologists, epidemiologists, public health nurses, physicians, and other professionals perform this work every day. In the 21st century, we need to make sure that a steady stream of bright young professionals enter the field of public health to continue to protect us all.
The Public Health Laboratory provides testing services to residents of the County of Sacramento. Our tests include detection of microbes that cause both food and waterborne outbreaks, tuberculosis, rabies, and we are also prepared for emergencies that may involve agents such as pandemic flu or West Nile virus. The laboratory is also prepared to support, if needed, the surrounding county public health laboratories. These services require trained and dedicated people. The Workforce Development Act provides a number of opportunities for people to begin their preparation for public health service.
It's estimated by 2020 we will be short 250,000 public health professionals in the U.S. That's about 1/3 of the total that are needed to meet our functions. And what that means for the workforce is that our very dedicated workforce is having to do more with less, and that's a challenge. For California alone, it's estimated that by 2020 we're going to need to increase our public health workforce by 50%, so we're shy about 27,000 new workers over a relatively short period of time. It's a crisis and it's a problem, but it actually is a problem with a solution, and actually an affordable solution, because we know that for every dollar invested in public health and prevention, you just simply dwarfs the benefit that you get for every dollar when you invest in medical care for results that otherwise happen that could have been prevented.
I want to begin by expressing my appreciation for all the public health professionals who work in this lab. You're really on the front lines of protecting our health every single day, and I really appreciate that. And I'd like to especially thank Dr. Trochet and Dr. Gonzalez for their leadership. I had a most interesting tour, and it was quite fascinating. I learned an awful lot. I ask a lot of questions, as you can tell. I'm that type of person. And as I went through today, and as I heard from Dean Rosenstock, you know, our public health community faces critical shortages today. We just cannot afford these shortages. Our public health care workforce is the bedrock of our emergency preparedness. When a virus threatens our schools or communities, public health workers are there. When a new strain of flu emerges, our public health workers are there. But their work is never done. This is 24 hours. I mean, this is just like firemen and policemen. Every day, they battle serious diseases that threaten communities across our city, our state, and our nation. Pandemic flu, tuberculosis, STDs, and many, many more. Over the past few months, I've heard about the concerns of dedicated professionals in the field. The challenges facing the dwindling ranks of this workforce are absolutely tremendous. Nearly a quarter of the current public health workforce will be eligible to retire in 5 years. 5 years goes by very, very quickly. I hate to tell you that, but it does. As a result, we must improve the recruitment and retention rates of public health care workers. Without them, we are vulnerable in this challenging and changing world. And that's why I introduced the Public Health Preparedness Workforce Development Act of 2008. Taking into account the advice of public health professionals and examining today's trends, this bill aims to rebuild the public health workforce through multiple avenues. First, it authorizes scholarships for public health students who agree to enter public health professions after graduation. Many well-trained graduates, I know, opt for higher paying jobs in the private sector. For our public health system to prosper, we need to continue to attract the best and the brightest people to work in labs like this. We must also retain the graduates that are already in the public health field To that end, my bill creates a loan repayment program, and I understand the loans are daunting, but this will help current public health workers repay student loans that they incurred. It will help put a stop to public health professionals leaving the workforce for more lucrative jobs elsewhere, many because they have these huge loans. In the year 2000, there were 50,000 fewer public health workers than in 1980. And just think about all the challenges we've had in those 20 years. This trend has to be reversed. We're losing valuable institutional knowledge and expertise with this too. No one can navigate his or her own career path alone. We are all dependent on mentors and senior practitioners in our respective fields. But we're losing these mentors very quickly, and there are fewer graduates for them to take under their wing. Therefore, my bill authorizes mid-career training scholarships. These will encourage talented members to stay in the field and become the leaders for the next generation of workers. In a field that is so dynamic, this kind of mid-career training and education is absolutely critical. This legislation will retain valuable experience by improving routes for advancement within the public health profession. It will allow for a more flexible and well-informed workforce. One way to do this is to ensure that academic health departments work more closely with public health agencies. That is why we need grants for academic health departments to create partnerships between schools and public health agencies and their communities. This concept, pioneered at UCLA, will provide public health agencies with a new source of fresh labor. Students working in academic public health departments can help reinvigorate the workforce even as they learn about their craft. More importantly, this new program will introduce students to the excitement and benefits of a career in public health. I am pleased that plans are in the works to bring more opportunities to students in the Sacramento region. I look forward to seeing the School of Public Health at UC Davis become a reality. Tracking and preventing outbursts of diseases like E. coli or pandemic flu is much cheaper than treating the sick in emergency rooms or doctors' offices. Educating the public about the risk factors of obesity is more effective than managing diabetes and health disease after these diseases strike. Establishing and updating community bioterrorism response plans is cheaper and safer than the pandemonium following an attack. You know, everybody knows that my top priority is keeping my constituents safe. The people of our public health community are in the front lines in helping to achieve this goal of public safety. Strengthening and growing our public health workforce is but one way that we can achieve this vision. I ask you to join me today to ensure that more people know about the importance of public health. I commit to do this, and I think it's important because, you know, we're sort of the hidden strength behind it all. And I say we because I feel like I want to be a part of this too. We prevent, and when we prevent, most people don't know. We'd hate to be the ones, when we'll be there when something bad happens. Then people know who we are. But public health isn't existing just to be there to help after the crisis occurs. We're there to prevent. So I want to thank everyone here, and especially thank you for being here. We're going to be partners in this, believe me. And I really want to say that this is something, it's up there along with making sure we have adequate resources for law enforcement and for the firefighters. We all understand that they're first responders, but so is public health. So thank you very much for everything you're doing.
We'll keep you updated on this issue as it progresses. For Public Health Today, I'm Carrie Shearer.